Good afternoon and welcome to CAN TV Cable 21. My name is Lucy Aquino, Chief Executive Officer of Hispanocare, a program of Advocate Illinois Masonic Medical Center. And today we have a very special show for you, one with a lot of information, important information that I know that you will take away with you. To remind our viewers, our lines are open. The numbers at the bottom of your screen. Area code 312-738-1060. So today with me, I have Dr. Jorge Cuevas, clinical psychologist with Advocate Illinois Masonic Medical Center and Behavioral Health Sciences over at Masonic. And Dr. Cuevas, our topic today we're going to be talking about, which is so important, is adult depression. This is something that a lot of people actually don't like talking about. Mm-hmm. And I know that, Dr. Cuevas, that it's estimated that in the United States, 16 million adults had at least one major depressive episode. And that was based in 2012. And that 6.9% of the population, and according to the World Health Organization, WHO, 350 million people worldwide suffer from depression. It is a leading cause of disability. 5 million Americans suffer from depression each year, and over 50% of all people who die by suicide suffer from major depression. Dr. Cuevas, you hear these things, we get depressed just hearing about it. And that's just a nonchalant way of saying it really is sad that this is happening, and that these things are happening. But Dr. Cuevas, can you talk to us a little about depression, what it is, and there's differences between depression and people just feeling sad and down and out.
Right.
Dr. Cuevas.
I think the main distinction we have to start with is sadness versus depression. So sadness is a normal emotion that many people experience in different times of their lives. Tends to be short-lived and usually lives either through intervention or without any intervention. Depression is a clinical definition, it's a clinical entity that has been recognized probably since mankind began writing. And actually, we have very prominent historical figures who fought depression. For example, Winston Churchill. He called it my black dog. That was his depression. So the definition of depression from the DSM-5, which is the diagnostic manual, a statistical manual that we use in mental health, is that you have at least 2 weeks of uninterrupted sad or dysphoric affect, and also a lack of pleasure or interest in life. So you have those two main symptoms that have to be present to start thinking about depression. And then on top of that, you have to have 3 other symptoms out of 9 or 10. I think the most prominent ones are you are either not eating or eating too much, you're sleeping too much or just sleeping barely enough and having what we call early morning awakenings, which are very common. People go to bed, they fall asleep quickly, and then 2 or 3 in the morning they wake up by themselves and they cannot go back to sleep. That can be a sign of depression. You might have motoric retardation, which is being slow, being sluggish, or agitation, agitation that some people show. You might have thoughts, negative thoughts about yourself, about the world, and about the future. And usually being hopeless about the future is one of the signs that we need to watch for when people are suicidal. Also, you have trouble concentrating, trouble learning, trouble making decisions. And in general, you just lost the joy of life. And that has to be a part of this, complex of symptoms. Depression tends to be chronic and come back even when it's treated successfully. And depression can happen almost in any time of your life, but it's usually most prominent in adult years, as you mentioned.
So it's really important, too, that if family members notice a change in that individual, what would you recommend to families who've noticed a change in a loved one, for example? What would you recommend?
Well, I will say that you need to talk to the person and mention that you have noticed that they're not the same selves, and ask if something happened. Because in general, in depression, we talk about 2 big groups. Chronic depression that tends to kind of pop up on its own, and reactive depression. And reactive depression is usually associated with losses, either anticipated losses or sudden losses. And sometimes the losses don't have to affect you directly, but they can affect people close or loved by you. Like a lot of people now are sad about what happened, in Florida or in Texas or in Puerto Rico.
Right.
But if it doesn't last more than 2 weeks and if it doesn't affect your life, it's just regular sadness that we all might go through.
Right.
So asking is one. The other one I think is particularly with men and with adolescents, they don't usually cry or they don't usually manifest depression as being very sad and being very melancholic, but they become irritable, they are short-fused, they might start abusing alcohol or they might get violent, or they might destroy things, they might engage in risky behavior, particularly adolescents, and that can be a sign of depression. So kind of pointing out to them. And if they don't want to talk to you, ask them to see the primary care doctor. Most primary care doctors nowadays, they use several paper and pencil instruments to detect depression on the visit. Because a lot of people go to the doctor with different symptoms, but they're really depression.
Now, I know that too. We were talking right before we came on the show about some other different symptoms on depression, because you have grieving, for example, when you lose a lost, you lose a loved one and someone that you care so much about, that depression could set in, but it's also grieving. And I know a lot of people will say, "Oh, she's really depressed about what happened to her loved one." Is it really depression or is it grief?
Well, technically speaking, it's not.
Right.
I mean, we talk about grieving and we talk about abnormal or pathological grieving. So one of the big distinctions between depression and grieving is that when people are grieving, their thoughts and their sadness is all connected to the lost person or to the lost situation. When you're grieving a job, when you're grieving a loved one, when you're grieving a situation. And some of them feel good about themselves, but they just recognize that their life is not the same without the loved one or without what is missing. Depression tends to be more generalized and more introspective and about the individual. I'm a failure, I am not, reaching my goals, or I can't think of anything that will cheer me up in the next 5 years. So it's quite different and more into the person than about somebody specifically. Now, grieving, people always ask, so how long is reasonable to grieve? Well, in general, we talk about 6 months. Some people take much longer, but if we see improvement, it's still normal grieving. When we see somebody stuck, particularly, let's say a year after the person died, and they haven't taken away, their clothing, they still have all the portraits around, they might have the ashes in the mantle, and they are shut down to the world, that's pathological grieving. So it's quite different.
Dr. Cuevas, we have a caller on the air. Caller?
Hi, my question is, if I have a loved one that I suspect might be experiencing depression, it seems like it's a very sensitive subject and something difficult to ask. Based on your experience, what do you think is the best way to approach that person to ask the question?
As I mentioned before, if you reflect the changes that you have seen in his or her behavior, that might be a more indirect way of going about it. I think when people say you're sad and you need help, or you're depressed and you need help, that direct approach might not work for most people. One of the issues with depression is the shame associated with it, and particularly with males or in any gender, but it's more common in some minorities and males, that they're not accepting of their weaknesses, they're not accepting of being less than. And when you say you're depressed, they see it as a threat to their self-worth. So just reflecting the changes that you see and that you're concerned about it might be an indirect way to figure it out if they're depressed or not depressed. With some people, you really can make the agreement that, okay, you're not depressed, but let's say you're drinking too much, you have not gone to work in 2 weeks. Could you go and see somebody who will tell me that you're not depressed? Could you go and see the professional? If you convince him that you're not depressed, if they decide that you're not depressed, then I will just let it go. And that's a good way to, make them probably access help that they badly need. So
I hope that helped, caller. So there are all kinds of treatments out there all kinds of treatments, and depending at what level and what's what. Dr. Cuevas, if somebody was to go to treatment, let's say it's, as the caller had mentioned or alluded to, and if someone needed treatment, obviously you're starting off with your primary care. Who is the person you should see to begin with? Treatment is recommended, usually. What are some of the courses of treatment that may take place?
Well, in general, both primary care doctors and internal medicine doctors, they have a stepwise approach to depression. So if the depression is mild to moderate, they might recommend talking to someone and frame it that way. They might ask a few questions. They might figure out if something changed in their lives or if there's some situation that is obviously connected to the depression. And for those cases, talk therapy, as is known, might be enough. If the depression is severe and they cannot go to work, or they're really drinking heavily, or they're having really prominent or somatic symptoms, they might then prescribe an antidepressant. The problem with prescribing antidepressants without the proper follow-up is that a lot of people feel the side effects before the therapeutic effects, so they tend to discontinue the medication. So really, it's better to refer them to a specialist or to start a treatment and see them every 2 weeks until the treatment is, kicking in, as they said.
Right.
Takes sometimes 30 days for many of the current medications to really help people with depression. So mild to moderate, therapies, severe, definitely medication and therapy too.
Right.
Because the studies show long-term is better to combine medication with therapy. There's less relapse when they stop the medication.
Thank you. I do want to remind our viewers that our lines are open. You can call us at area code 312-738-1060. And with me today is Dr. Jorge Cuevas, clinical psychologist with Advocate Illinois Masonic Medical Center. And our topic today is depression. So why is early intervention so important?
Well, it's extremely important in many fronts, but one of the main ones is really, I think you mentioned, depression is one of the main reasons of disability when it's not related to an injury, and also is a predictor of suicide. So the longer depression goes on, the more likely that people will either lose their job or drop out of a school or eventually become permanently disabled. So not only intervention, but just intervention, timely intervention is very helpful. The problem is sometimes people don't recognize it, or if they recognize it, they don't have access to the proper, treatment. At the clinic that I work, we're trying to combine both individual treatment with group. And some people are more open to group, and that's another way to go about it.
Yeah, well, if you think about a group discussion, it is more of an informal type of thing, but it's also meeting other individuals that are going through some of the same things. And at the same time, they're strangers, and people tend to talk to strangers before they talk to anybody at home.
Absolutely. Yeah,
Right.
absolutely.
So, Dr. Cuevas, based on some of the services even today, I mean, you have a lot of services that may or may not be available. We do have the different cultures in a city, and actually trying to get someone who's a clinical psychologist they can go to who speaks their language or understands your culture, that's also a big deal. So if you're looking for someone, especially if they have that problem, trying to find someone with a particular language, what do you suggest?
Well, I will suggest to people to look at the organizations we have in the city. And we have run into this problem at the clinic. People come and we do an assessment and we diagnose depression. They barely speak English, or they barely speak whatever language we have at the clinic, and they need somebody who speaks Orsi, So there's Asian services. So usually reaching out is the first step. Even if they don't speak your language, they might know how to how to get you to the proper services. I think we're a very multicultural, multilingual city. I think we have services in Polish, but particularly Asian languages are difficult to find. But we have a few. And also psychiatric services, not at our clinic, but in clinics in town.
Right.
But at least reaching out is a good way to get started.
And since we're talking about culture too, I mean, how do you bring somebody in from a different culture? How would you handle that? I mean, if you as a family member knows that a loved one is in need of some assistance,
Okay.
how do you convince that individual to go?
It's a very good point. I think it varies from individual to individual, but I think if you frame the problem, particularly with some of the minorities that we have in town, as a family issue, as something that is hurting the family, something that the kids are noticing, people might be more willing to get help as family therapy, as a family unit. If you frame it as it's your problem and you need to fix it, it's a non-starter for many of them.
Right.
Particularly because some groups they see depression as something shameful, a fault on their own, and they're not willing to admit that.
Yeah, and and even in our Latino culture, I mean, we have many who will say, "I'm not crazy.
Right.
Why are you making me go or want me to go to see a psychologist? I'm not crazy. So why are you trying to make me go?"
And they equate mental illness
Right.
or extreme mental illness
Right.
with depression, which
Right.
is fairly common.
Right.
So.
Right. And if there's any advice that you can give our viewers, Dr. Cuevas, what would that be?
Well, I think some healthy habits really mention prevention and mention not relapsing. We have figured out that are very helpful in either preventing depression or alleviating depression. Number one is keeping a regular sleep schedule and sleeping enough. A lot of people, when they're sleep deprived, they show symptoms that could mimic, a bout of depression. And when it's not, it's just not sleeping enough. Being distracted, not being able to concentrate, not having energy, etc. The other one is regular exercise, particularly aerobic exercise. It doesn't have to be extreme, 30 minutes per day or 150 minutes per week cumulative. It's a great way of either alleviating depression or preventing depression, regular aerobic exercise. Having a sense of humor, trying
Right.
to do fun things,
Right.
watching comedy, talking jokes, etc. And, social support, seeking
Right.
social support, either through your family, through your friends, through your church. Social support, it does improve your condition and helps people, avert depression or ease the depression.
I come across many individuals and professionals as well as non-professionals who will tell me, "I'm okay staying home 5 days or 6 days. I've got 2 weeks vacation and all I'm going to do is stay home." And they'll flop themselves in front of the sofa, watch TV for 2 weeks. I think there's something wrong with that.
It depends on the individual because some individuals have been working so hard
Right.
that they need that vegetating time
Right.
to recover sleep, recover just mental clarity. I think more than a week it can be problematic,
Right.
and it tends to perpetuate itself. One of the most effective techniques from the psychological perspective to deal with depression is what we call activity planning.
Okay.
And what we ask people to figure out is what are the pleasurable and what are the activities that give you a sense of worth that you can engage in. And can be very simple activities or can be very complicated activities, and we help people break them down. And they realize that if they wait until they feel like it, they will never do it.
Right.
But if they make the commitment in therapy or in group to, okay, this week I'm going to try this, and then they have to report to the therapist or to the group,
Right.
I try it, I felt this way, invariably they feel much better.
Right.
And they feel also better because they try it at least. So activity planning, what we call the pleasure index, is tend to be very low in people with depression. So we try to increase that pleasure index. Now, these have to be healthy pleasures, not unhealthy pleasures.
Right.
So we're not talking about drug abuse, and we're not talking about alcoholism, we're not talking about risky behavior, because that can create other problems.
Absolutely.
Mhm.
So, Dr. Cuevas, with so many issues and things that are happening around the world
Mhm.
with our hurricanes, and now we have that fire in Sonoma, California,
Right.
and there's just so much going on. You have children who don't understand and are hearing so much because it's on the news 24/7. And I want to just jump a little bit into that. If you can just take a couple of minutes and how maybe parents can maybe help children understand, or at least present it to them in such a way where it can comfort them to the point where they're not so worried that hurricanes are going to come down on them as well.
Yeah, I think that's an interesting question. I think you have to know the age of the children and understand that they don't think like we do.
Right.
So many of them don't have abstract thinking, and they don't have a sense of how time goes by. So has to be, the message always has to be adapted to the age of the kid. And some of the little kids, they shouldn't be exposed to that because they're not going to understand. But they're going to be exposed to reaction to news. So
Right.
you also have to modulate that. Older kids, 10 and older, they tend to think more logically, and you can explain to them that it's not going to happen here, and you can research that, and you can show them, look at the history books. But also you have to limit how much they're exposed to. Because, the news are created for people to make it pay attention, and sometimes it's in a very negative way that they draw us into what they're saying, and they create this sense that life is unpredictable, life is a mess, and everything is going to go to hell in a basket,
Right.
when it's not true, because you can see news from 30 years ago saying exactly the same thing and nothing happened,
Right.
but they don't know that. So to make the message appropriate to the age, and then to help them, and then to detox from the news, even us adults, we should detox from the news regularly.
I mean, because right now you're seeing. I'm going to talk a little bit about Puerto Rico, which is my home, and it is very depressing to see what's
Right,
happening,
right.
and at the same time know that we're here. Many are here, and there's nothing they can do to go back home to help out.
Exactly.
And yet they're sitting here saying that how helpless they are.
Right. Well, I guess there are ways to use that energy and that compassion that you're feeling that is constructive for the island without necessarily having to take the first flight down there. And we need to help them not be drowned into the emotion of the situation and try to be a little bit more logical about it. Like, a good question always to ask yourself is, what is the best use of my resources given my current circumstances? So we're here in Chicago, we can't fly down there, and maybe we'll just be, obstructing
Right.
whatever
What's
other
going
people
on,
are
sure.
doing. So maybe make a donation, maybe do a collection, maybe organize a prayer group, whatever your avenue is, just do something about it, but something that is related to your capabilities here. And not just watch TV 24/7 and then commiserate about the situation, because that's not going to help.
Absolutely.
Don't be paralyzed by all this horrendous circumstances.
Right. Viewers, I do want to remind you that with me today is Dr. Jorge Cuevas, a clinical psychologist with Advocate Illinois Masonic Medical Center, Behavior Sciences area. And if you have questions, or if you need to speak to someone, or you're looking for just information or whatever it is, please, you can either give him a call or any of our other psychologists on staff, and you can reach him at area code 773-296-3220. Again, that number is 773-296-3220, and that is with Advocate Illinois Masonic Medical Center. Dr. Cuevas, time here goes by so quickly, and it
Amazing.
just seems like, we can talk and talk and talk, but if you can leave a last note to our viewers, what would you like to say to them?
I think to make the distinction between sadness, grief, normal grief, and depression, and to really look into it. And we have really good resources, particularly in the internet. There's a bunch of websites, many of them in different languages,
Right.
that can help you make that distinction. And then there's, NAMI, the National Association of
Right.
Mental Illness, that has really good, well-balanced
Right.
information.
Right.
And then, you always your primary care doctor, your nurse, and the people that you know
Right.
around. Just
Right.
talk about it, because talking really helps people figure it out, and also have the emotional release and figure out if they are or not depressed.
Right, very important. So please remember that you're not alone. There are ways that you can feel better, but only you can make that happen. If you've been feeling sad or hopeless or irritable, or what seems like for such a long time that it's been going on, please seek some help. Talk to someone. Reach for that help. There are people there who love you, care about you, and want to make sure that you're okay, just as I'm sure you would do the same for them. On that note, on behalf of my colleagues here at Hispanocare at Illinois Masonic Medical Center, Dr. Cuevas, thank you so much for
You're
being on the
welcome.
show
It's a
today. I
pleasure being
really
with
do
you.
appreciate that. And allowing us to share such important information with you. On a bittersweet note, I would like to let you know and let our viewers know that this is Hispanocare's last show. We've been doing this for about 12 years, and many things have come and gone, and many changes come and go. So it is bittersweet but we have enjoyed doing these shows for you, for our viewers, and hopefully we brought you a lot of things that you learned from and brought you some information that you utilize. And on that note, I know that I will see you again, and thank you. Thank you for
Welcome.
coming,
Thank
and
you for
thank you
having
for
me.
being in our show
It's a
today.
pleasure.
And we'll see you around. So, and stay tuned. A lot of more information coming your way on Can Cable 21. Always good to tune in. They've always got a lot of good things to share. So until next time, take care. Have a good evening.
Good evening.